It really depends on the specific peptide. Some peptides you'll notice immediately, such as sermorelin, you might notice with a really good night's sleep. But for most peptides in general, we tell patients usually it takes 1 to 2 weeks for the effects to kick in. This is a great question that we get all the time, and pretty much any peptide can go together with another peptide, but we usually like to keep it goal specific. So, for instance, a really common stack we see is BPC 157 with TV 500, otherwise known as the Wolverine blend. Those two go really well together for recovery and healing, or say you're post operation. We like to use those combinations for like a targeted goal. Another one is CJC and ipamorelin, which is commonly used together. Those two work very well synergistically for the growth hormone boosting effect. But you can use any kind of peptide with another one, but we just like to reverse engineer the patient's goal specific. And then from there, we can develop like a protocol or a combo for them to use. But any stacks can work. This is very patient specific. Everybody's different. I can tell you in general, peptides are very safe and well tolerated, which is part of the reason they're gaining such popularity. It's really rare, but sometimes we'll have minor injection site irritations or maybe fatigue when you're adapting to the peptide. But other than that, besides some minor side effects, we don't really see many side effects other than maybe some minor flushing with some of the growth hormone secretagogues. But it usually goes away as patients adapt. As long as you are being seen by a knowledgeable medical provider, such as Dr. Noon, they're very safe, especially when they're monitored week to week. We like usually like a typical cycle would be 8 to 12 weeks on and maybe 2 to 4 weeks off, just to let them become desensitized again.